My name is Serena Polikis, and my disease is hemophilia. Typical patient presentation. Karen spends a few nights in the hospital after giving birth to her son Bob, where she then makes the decision to get him circumcised. After the procedure, the doctors cover him with gauze to keep him protected. As time progresses, the bleeding intensifies, resulting in the doctors having to change his gauze multiple times. He starts to bleed profusely, which becomes very difficult to control, concerning the doctors. Bob is then rushed to the intensive care unit to have tests done on his coagulation factors. Next, we have etiology. There are three types of hemophilia. The first one is hemophilia A, which is the most common. It is a disorder where your body is deficient of the anti-hemophilic factor, or in other words, clotting factor 8, which is a protein in the blood that helps form clots. It is an X-linked recessive disorder, meaning the affected gene is located on the X chromosome. It affects males, meaning they can get hemophilia, but with women, they become carriers, so they can pass the gene on, but they're asymptomatic themselves. The next type is hemophilia B, and it is clinically indistinguishable from hemophilia A because both of their clotting factors function together. It is similar to type A because it is a hereditary disorder inherited in an X-linked recessive pattern. However, it's a deficiency in clotting factor 9, which is produced in the liver. The graphic on the right says, "Good grief, I thought Christmas disease would be fun to have. Sadly, it is not." Hemophilia B is also known as Christmas disease because it was named after the first person who was diagnosed with it. Lastly, we have type C, which is the rarest form of hemophilia. It is a congenital deficiency of plasma thromboplastin antecedent, which in simpler terms is a deficiency of clotting factor 11. This deficiency makes it difficult for a person to form proper blood clots. This condition affects men and women because it's not sex-linked. It is inherited in an autosomal recessive pattern, which means both parents must carry the mutated gene to pass it on to their child, and this is why it's the rarest form of hemophilia. This diagram shows the possible outcomes that their kids could be with a normal, healthy male and a female who is a carrier of the hemophilia gene. The mother, although she is a carrier, is asymptomatic. When these two cross, there is a 50% chance that their son will have hemophilia and a 50% chance that the daughter will be a carrier. Son B inherited his mother's hemophilia gene, which is why he is affected and has the disease, whereas daughter B also inherited the affected gene, but instead of having the disease, she becomes a carrier like her mother. Son A and daughter A, they received both parents' healthy genes, which is why they are unaffected. The background of the disease. Hemophilia A affects 1 in every 5,000 males, while B affects 1 in every 30,000 males. Both A and B have no effect on race. Everyone has an equal chance of getting it. Hemophilia C affects 1 in every 100,000 people in general, whether it's male or female. Type C mostly affects people of Ashkenazi Jewish descent, where it affects 8% of the entire population. However, anyone can still get it. Worldwide incidence is not well known, but it is estimated to be more than 400,000 people. Hemophilia is classified as royal disease because the hemophilia gene was passed from Queen Victoria in 1837. The life expectancy is around 10 years less than a healthy male. People with hemophilia generally live a pretty normal life due to modern medicine and the available treatments. To put this in perspective, people who receive proper treatment have a 40% lower chance of dying from a bleeding complication compared to someone who doesn't receive treatment at all. The greatest cause of death for people with hemophilia is intracranial hemorrhage. This mostly occurs during vaginal delivery, which is why if someone suspects there's a chance their kid would have this disease, many doctors would recommend a C-section to prevent this. Risk factors of the disease, the first one being family history of hemophilia. It is a genetic disorder, meaning if your elders have it, there's a high possibility you will too. It's also most common among males. Since men only have one X chromosome, if they inherit the affected chromosome, then they will have the disease. Women, on the other hand, have two X chromosomes, meaning the possibility of them having hemophilia is rare. However, there is a chance that she will be a carrier if she inherited the gene for hemophilia. People of Ashkenazi Jewish descent are also at a higher risk for having type C. Since hemophilia is a genetic disorder, there is no way to prevent getting it. The pathophysiology of the disease. Hemophilia is a genetic disease leading to insufficiency in a specific clotting factor. These deficiencies lead to blood not being able to clot properly, causing profuse and uncontrollable bleeding. This often leads to life-threatening situations if it's not treated properly. Complication of internal bleeding. Internal bleeding is most common in the knee, ankle, elbow, and hip joints. When this happens, the blood accumulates, causing immense pain and swelling. If the soft tissues bleed, it can cause large bruising as well. The most severe situation is intracranial hemorrhaging. It needs immediate attention because it's a life-threatening situation. If internal bleeding is left untreated, it can lead to organ failure, coma, and eventually death. On the left side of the diagram, it shows the process of a healthy person after bleeding, and on the right side, a picture of someone with hemophilia after bleeding. When there is injury and someone starts to bleed, the vessels constrict. The narrowing of blood vessel is crucial to slow down blood loss. Platelets are activated and stick to the wound to form a plug. Fibrin is then produced to form a clot to stop the bleeding and heal the wound. A person with hemophilia after an injury forms plugs as well. The difference is that they're missing a specific clotting factor, which then can't fully activate the fibrin. The fibrin produced isn't strong enough to hold the plug, so a clot is not formed, which the person then continues to bleed out. This figure is known as a coagulation cascade. This process starts coagulation, and there's the intrinsic pathway, which takes place within lumen of blood vessels, and the extrinsic, which requires tissue factor, which is not found in the blood vessels. The intrinsic pathway requires clotting factors 11, 9, and 8, while the extrinsic pathway requires 8, 10, and 5. Fibrogen is converted to fibrin by thrombin to form a blood clot. The two pathways work together in a positive feedback loop to produce enough fibrin to stop the bleeding. If someone has hemophilia A, they are deficient in clotting factor 8. If someone has B, they're deficient in 9, and C in 11. They would be deficient in one of these blood clotting factors, and these deficiencies slow the overall process, which ultimately slows the formation of blood clotting. Complication of joint bleeding. This is also known as hemarthrosis. People with hemophilia can bleed in their joints due to their lack of clotting factors, which result in pain, swelling, tingling, and joint stiffness. Due to the deficiency in clotting factors, this can happen after trauma or even spontaneously. The increase in pressure is due to the pooling of blood, which causes immense pain and swelling that can deform the joint. It is important to seek immediate help if you believe you have a joint bleed, because it can lead to serious damage resulting in needing to get a joint replacement surgery. This is a visual of the complication of joint bleeding. There's pooling of blood in between joints, causing the lining of your joints to break down, and also swelling of the synovial membrane. This picture shows how inflamed your joints become. Complication of synovitis. Synovitis is inflammation of the synovial membrane. This membrane lines joints and tendons and functions to prevent friction. The synovium removes fluid from the joint, so when someone is bleeding into their joint, it becomes absorbed by the synovium, causing inflammation. The synovium contains blood vessels, so when it is inflamed, it makes someone more susceptible to bleeding. It also destroys surrounding cartilage, resulting in pain. Symptoms of hemophilia is dependent on the severity of your disease. A normal person has blood clotting factors anywhere from 50 to 150%. The diagram on the right shows different percentages of clotting factors and the level of severity it classifies as. With mild hemophilia, it is often infrequent, and a major trauma or surgery is required and followed with bleeding. An example of this is dental procedures. With moderate hemophilia, bleeding occurs after minor injuries. An example of this is circumcision. Usually, it's accompanied with a little bleeding, but a person with this disease will have profuse bleeding after the surgery. The last type is severe hemophilia, which is spontaneous and frequent bleeding. An example is bleeding into the joints. This is common with internal bleeding as well, which would lead to blood in the urine or stool and large bruises. Among hemophilia patients, the majority of people have severe hemophilia. If someone has a family history of hemophilia, there are two tests that can be used to test for it. The first is amniocentesis. It tests amniotic fluid by removing it from the uterus. The next test is chorionic villus sampling, where chorionic villi is removed from the placenta. I included the chart on the right again because after the genetic testing, doctors will be able to see if the patient's blood clotting factor is between normal range. If it is not, then they are able to diagnose the patient with hemophilia. Screening tests are also available, and they show if blood is clotting properly. Doctors are able to do a complete blood count, which measures the amount of hemoglobin and the size and number of red and white blood cells. A person with hemophilia has a decreased amount of hemoglobin and red blood cells due to continuous bleeding. There is also the activated partial thromboplastin time test. It measures the time it takes for blood to clot. Low levels are indicators of hemophilia A, B, or C, depending on what you're deficient in. Hemophilia can't be cured, but there are a lot of effective treatments. The first is replacement therapy. The clotting factor you're deficient in is injected into your vein to replace the low levels. Most of the blood used in replacement therapy derives from human blood. However, it's first treated to reduce the risk of developing hepatitis or HIV. There's also options like recombinant clotting factors, which aren't made from human blood, which can be stored and administered at home. Depending on the severity of your condition, there are two options to consider. The first being prophylaxis therapy. This is generally for patients with mild to moderate conditions. It is weekly infusions of blood clotting factors to help prevent bleeding. Children who get this treatment have proved to shown less bleeding episodes. There's also on-demand therapy, which is an infusion given right after a bleed happens to help control it. However, if it's not given right away, it can become severe and hard to control. Another option is desmopressin. It is short term, which is why people take it when they know they're about to undergo a mild trauma. For example, going to the dentist. It's only used for hemophilia A, and it's a hormone that increases clotting factor 8. Gene therapy is an ongoing experimental treatment. The goal is to encode a gene for the clotting factor that the person is originally missing. These are my references, and thank you for listening.